Heartburn is on the rise in America, reflecting our fast-paced lifestyles and habits. At the DeKalb Medical Heartburn Solutions Center, we understand and are here to help.
The number one reason that people visit their GI doctor is for heartburn. That's also known as gastroesophageal reflux disease, or GERD. Due to the increasing diagnosis of heartburn, DeKalb Medical created the Heartburn Solutions Center in order to address the needs of our community.
In the community, a patient will go to their doctor and they get lost in the process. So what we do in the Heartburn Center is help navigate through that process. So many patients are put on medication for years and the symptoms are masked and it's really not solving their problem of reflux.
Reflux disease is caused by the main muscle in the esophagus not working properly. Its inappropriate relaxation causes acid to back up from the stomach into the esophagus, and over time, the acid can wear away tissue, cause pain, and even cancer.
People who have long-standing heartburn, a small subset of people may go on to develop esophageal cancer.
If you're experiencing heartburn yourself, be mindful of your symptoms and consider visiting a specialist.
Symptoms of GERD can include mild heartburn, which may occur once or twice a week, to severe acid reflux, where patients actually are choking when they're lying down, and the acid is actually going up from their stomach and it can go up into their lungs.
There's also a subset of people who actually have no typical reflux symptoms at all, but will present with a complication without knowing that they had underlying reflux disease. And we now link the acid reflux with such symptoms as asthma and cough. Thankfully, the testing options that we have here at DeKalb Medical and the treatment options are keeping pace with this growing disease. We have the ability to do very specific testing for reflux disease, and that includes manometry testing, pH Bravo testing, upper endoscopy, and barium studies to help us pinpoint the exact root cause of the disease in that person.
The specialized nurse navigator is with the patients every step of the way, referring them to the appropriate physician, scheduling testing, and even administering some of the tests.
After someone has gone through our comprehensive testing, we will come up with a tailor-made evaluation and treatment plan for that patient.
Treatment options may include lifestyle changes and medication, as well as surgery.
Well, I think there are many facets to the treatment of reflux disease. There are a group of patients who suffer from reflux disease who either have side effects from medicine or don't want to face long-term use of the medicine, who are candidates for the surgery that we offer here at DeKalb Medical.
The first surgical option would be the standard procedure known as the Nissen Fundoplication, which involves wrapping your stomach around itself and the lower esophagus. And the second procedure is something called the Lynx procedure, which involves simply placing a magnetic bracelet around the lower esophagus. This bracelet stretches and it allows the food to pass by into the stomach normally. And once the food passes by, the magnets reattach and increase the pressure to prevent the acid from going back up.
DeKalb Medical was the first full-service hospital in the metro Atlanta area to perform the Lynx procedure on a patient with severe reflux. Its skilled team includes expert surgeons as well as highly trained specialists in the comprehensive testing and treatment of GERD.
What sets us apart from other locations is we are inside of a hospital. So if a patient has anything that could go wrong, they're secure within the hospital.
2/3 of patients who suffer from heartburn will respond to appropriate lifestyle modifications and medication. We're fortunate that they're very satisfied with their treatment regimen.
We just finished his endoscopy.
Our satisfaction rate is also high for patients who choose surgical options for their reflux disease.
We have a team in the Heartburn Solutions Center. Pulmonologists, surgeons, GI physicians, radiologists all come together to find a solution to help the patient. We take the patient all the way from the beginning to the end and give them a comfort place to come to.
With the advent of very good medications and with the surgical options that we have here at DeKalb Medical, it's very satisfying as a physician to be able to treat and really have an impact on the symptoms of our patients.
For more information about GERD and how our center can help, visit us on the web at atlantaheartburnsolutioncenter.org or give us a call at 404-262-7387.